You know that feeling when you take your socks off at night and see those deep lines etched right into your skin? Well, today we're going to treat that evening leg discomfort as a genuine medical mystery. We are uncovering exactly why those tight ankles are often the very first alarm bell ringing from your internal organs, signaling that something deeper really needs your attention.
If your shoes feel incredibly snug by dinner time, you are definitely not alone. The data actually shows that nearly 20% of adults over the age of 45 notice their shoes and ankles feeling distinctly tight by the end of the day. It's an incredibly common phenomenon, but its commonality kind of masks how important it really is.
And this highlights a massive misconception we have as a society. A staggering 85% of people just dismiss the swelling as being tired, or maybe they blame it on a hot summer day. But by shrugging it off, they are completely ignoring the underlying biology and missing a vital window for early intervention.
So here is our game plan for today. We'll start with a quick self-check, weigh lifestyle factors against actual danger, dig into the 5 major causes, highlight the red flags, and finally, build out some practical steps.
All right, section 1. Let's jump into a quick self-check to test for edema.
We're going to do a simple 3-step pitting edema test to help you immediately figure out if you're retaining dangerous fluid. And you can literally do this right where you're sitting. Step 1, just press your thumb directly into the flesh of your lower leg. Step 2, hold it there firmly for 5 full seconds. And step 3, release it and watch the skin. If it leaves a noticeable indentation, like a little pit that doesn't immediately bounce back, well, you aren't just dealing with normal inflammation. You are actively retaining fluid, which completely changes the conversation.
Moving on to Section 2, Lifestyle versus Danger. What exactly is causing your swelling?
Now, you might just be dealing with what we can call lifestyle puffiness. These are the everyday triggers that set the stage for fluid buildup. Prolonged sitting is a massive culprit here. When you sit for hours, gravity pulls that fluid down and your calf muscles aren't pumping to push it back up. Add in excess salt from your diet, which forces your body to hold on to water. Throw in chronic stress, alcohol consumption, and heavy caffeine intake, and you've basically created the perfect recipe for swollen ankles by 5 p.m.
But listen, we absolutely have to rule out the severe dangers before we just blame a salty lunch. We have to talk about deep vein thrombosis, or DVT. This is a terrifying scenario where a dangerous blood clot forms in a deep vein in your leg. The risk here is immense because that clot can break loose and travel straight to your lungs in mere minutes, causing a pulmonary embolism, which is a life-threatening blockage of blood flow to your lungs.
So we really need to explicitly contrast harmless evening puffiness with life-threatening edema. It's the difference between the annoyance of sitting too long and a potentially fatal situation caused by systemic organ failure or deep vein clots. Understanding the vast scale of these possibilities is absolutely vital for your next doctor's visit so you know exactly how to advocate for yourself.
Okay, Section 3. Let's look at the 5 major causes behind the swelling.
There are 5 major categories connecting your biology to this condition. First up is the cardiovascular system. Think hypertension and heart failure, where your heart is literally struggling to pump fluid efficiently around your body. Second is the venous system, which involves varicose veins and chronic venous insufficiency, where the valves in your legs just fail. Third, we have hormonal factors, particularly the massive shifts during menopause or complications from diabetes. Fourth is renal, meaning kidney disease or a leaky kidney that can't properly filter waste and fluids. And finally, the mechanical system. This one is wild. Hidden structural issues in your lower back or pelvis can physically pinch and compress your lymphatic pathways, meaning a problem in your spine could literally be the reason your ankles are swelling.
Which brings us to Section 4. Red flags. Warning signs you absolutely cannot ignore.
These are the absolute red flags, so please commit these to memory. If you have sudden one-sided leg pain, meaning one leg is swollen and hurting while the other is totally fine, that is a huge warning sign for a clot. If you feel unexplained warmth radiating from the leg, notice sudden changes in your skin color, or experience any shortness of breath, you need immediate medical attention. Seriously, do not wait around to see if it gets better.
Finally, Section 5, Practical Steps for Actionable Relief.
Fortunately, if you don't have those emergency symptoms, there are some incredibly effective, evidence-backed tools you can use right now. First, you've got to take frequent movement breaks. You need to activate that calf muscle pump to physically push the fluid back up towards your heart. Second, reduce your daily sodium intake to stop the water retention at its source. Third, consider using targeted compression stockings to manually support your veins. And most importantly, when you speak with your doctor, bring up age-related hormonal and vascular changes specifically. Don't just say your feet hurt, ask them to look at the underlying systems.
So the crucial point to take away from this explainer is actually pretty simple. Spotting these patterns early can prevent major complications like heart failure or a pulmonary embolism. Paying attention to a symptom as seemingly small as tight socks can genuinely save your life. It empowers you to stop severe complications right in their tracks before they even have a chance to escalate. You now have the framework to distinguish harmless puffiness from systemic danger. You understand the 5 major systems at play, and you know the exact red flags to watch out for. So now that you know how to read the signs, take a quick look down right now and ask yourself this vital question. What are your ankles telling you today?